I'm very excited today as I'm interviewing Dr. Simone Rofena, a top fertility doctor in London, specialized in gynecologist, obstetric and reproductive medicine. He's also launched his own clinic, Vita Fertility, and is the top leading doctor at Lanserhof at the Arts Club Clinic, where we are filming today. Dr. Simone, welcome to the show.
Thank you, Francesca. It's a pleasure.
I am so excited to have you, and I want to go straight into the point. Do we have a fertility epidemic? Because in our society, there are many more people that are infertile. Is this due to our lifestyle or is about genetics?
Yeah, I would say lifestyle is very important, more than genetics, I would say, because particularly in the industrialized countries, the lifestyle is having a greater impact on fertility causes. So if you think about things like pollution, processed foods, all of these things are having a big impact on our body, on our weight, and therefore also on fertility.
So do you think if people will look more into having a healthy lifestyle, so no smoking, less alcohol, less stress, will become more fertile?
Yeah, at least they can reduce the damages that all these things are causing to eggs and sperm. You mentioned alcohol, I would add smoke, as I said, pollution. All these things can have a very bad impact on both sperm and eggs, and they can increase infertility, particularly on those cases when there are other factors like advanced age, for example, or other reasons.
On that note, do you think that people in our society are waiting too long to have a baby, are trying too late in life?
Definitely. That we would say is actually the main reason for female infertility. Advanced maternal age is by far the main reason, much more than anything else, much more than genetics. And this is really an issue that sometimes cannot even be resolved with IVF. I've got some patients who expect IVF to solve all the problems, but sometimes when age is really advanced, even with IVF it can be hard. So that's why the advice I always give is to try to have children sooner if possible, or preserving fertility through egg freezing, for example, or embryo freezing.
That's very good, but I always think people are doing IVF to, let me rephrase this. IVF is something to fix the problem instead than actually prevent it or cure it from the roots. Would you agree on that?
I would agree on that. What I just said is that the problem is not always fixable with IVF.
Mm-hmm.
People expect IVF to be the solution for everything, and sometimes that's not the case, particularly when the age is too advanced to have good quality of the eggs, because that is the problem. If the egg quality is not sufficient anymore, even with IVF, we might not achieve what we want.
Okay, so one way to prevent could be egg freezing.
Absolutely. Egg freezing would be an excellent way to prevent this, because if a woman freezes her eggs when she's young, then she can use those eggs even 10 days later, and they will still keep the quality as when the woman froze the eggs. So that's the best way to preserve fertility, actually.
Oh, fantastic. But at the moment we are addressing this as if it's an issue only from female, but I think is this a male or a female problem, or the truth is in the middle?
Absolutely, no, you touch a very good point. Actually, statistically, is the same. Is 30-40% for female and 30-40% for male. And people don't always know that, particularly men. They tend culturally sometimes to think that the problem is the woman. So men are very much underdiagnosed, I would say. But statistically, is the same percentage. 30-40% on each, and there are cases when the problem is combined, so it might affect both.
Oh my God, that's more complicated.
Which is even more complicated, yes. And in a minority of cases we talk about unexplained infertility. So when we haven't found a specific reason, but still the couple is struggling to conceive.
But can a healthy body still be infertile?
It can, because there are a lot of things, Francesca, that you don't see. For example, hormones. Okay, a person can look healthy, but can have, for example, hormonal imbalances. That is very common in, for example, in polycystic ovary, which is a condition that has an hormonal imbalance. Or some women struggle to conceive because they have low progesterone, okay, the so-called luteal phase deficiency. And that is true for both natural pregnancies and even IVF. In fact, IVF needs to be supported with a lot of progesterone, but I very often give progesterone even for natural conception, and if that is the only problem, it is very helpful to fix it. So yeah, the answer to your question is yes. A person can look very healthy, but still having some problems.
So are hormones the driver of fertility?
They are, because hormones regulates everything. In the woman, they regulate ovulation, regular cycle. In men, they regulate the sperm production, so they are really at the base of everything.
Are there some hormones that they are better than others?
Well, I mean, the reproductive hormones are the most important, FSH and LH in particular, because FSH is responsible for ovulation in women and for sperm production in men. So it is a hormone that should always be tested, particularly in men, because if that is low, it can cause low production of sperm. And if you just replace it, the sperm production is completely restored. So yeah, that's why both men and women should have a hormonal test as a basis to start with.
Okay, and just before you say polycystic ovaries, on this front I want to address the issue of contraceptive. So basically, female, especially since at a young age, they get the pill, the coil, not only to avoid having a baby, but also to cure disease as polycystic ovaries. Is this going to cause a problem later in life with infertility? And after they stop contraceptive, how long the cycle will resume natural flow?
All the hormonal contraceptives, so contraceptive pill and also the IUD releasing hormones, luckily have a quick period to leave the body. So you would expect the fertility and the cycle in most of the cases to come back within 1 to 3 months. Okay, so they don't have a long-term effect. Okay, particularly with the actual doses that are used for the contraceptive pill, which are much lower than 20, 30 years ago. So I would like to reassure our patients about not having permanent long-term effects after stopping the pill, for example. So normally fertility should be restored quite quickly.
Oh, that's a good news. And this is a very kind of a bit of a more of a kinky question, but is there a special sex pose that can facilitate fertility?
Well, actually, this is a question I'm asked sometimes, and the science hasn't found really a specific position that could be more fertile. So there is no evidence, there is no scientific evidence that one position might be better than another. So my answer to this would be no. It's important to have sex frequently, yes, of course, particularly around the window of ovulation, okay, but about a specific position, no, this is not supported by evidence, I would say.
So Francesca's advice is try them all. And do you think that, because there is this myth that women have to lie still after sex happened, they need to lie still in order to conceive better after the ejaculation. Is that correct, or it's a myth?
No, that I would say that's another myth together with the position, because again, the sperm can reach the cervix where it needs to enter to start the journey to fertilize an egg very easily. It can reach, doesn't matter the position, it doesn't matter the gravity, the sperm will find its way. So, you know, staying with the legs up for half an hour is not supposed to increase the chance.
That's good, because I always tell people to move more. And one more question, is female orgasm or male orgasm actually facilitate fertility?
Well, again, for female it doesn't make any difference, okay? For men is the opposite. For men is a necessary requirement, because in order to have ejaculation, a man should have an orgasm. So yeah, for men is mandatory, for women not.
Okay, fantastic. And there is a lot of people in our days that they are on GLP-1 peptides, drugs like Ozempic, Mounjaro. Do these drugs facilitate fertility or the opposite?
Okay, so let's say that these medications are quite recent, so their effect on fertility is still under investigation. We don't have a clear answer yet. I think it might take a few years before we know. What I can certainly say is that they are very helpful in case of an excessive amount of weight. Because an excessive amount of weight can cause a lot of problems, like cycle irregularities, for example, which then in turn will affect fertility. So if a woman manages to lose weight through these medications, this will help her fertility. But if a woman is already in a good weight, in a normal weight, then there is a risk, because being underweight actually can cause problem.
Of course.
You can see this in, for example, in athletes, professional athletes, or
ballerinas.
Or ballerinas. Very often they lose their cycle completely, because you need a certain amount of fat tissue to produce estrogens. And estrogens are the hormones that maintain a regular cycle. So the answer is a good balance is always best. Not to be overweight, but also not underweight.
But you are addressing this as if only a women problem, but do men have to lose weight as well and look at their nutrition?
Absolutely, they do, because there is a correlation actually between body weight and sperm quality in men as well. So men should also pay attention to their diet, their lifestyle, doing physical activity, because obesity can affect both female and male fertility.
Yeah, that's what I thought. It's very, very important. Is there any food that you would advise to increase sperm count, or for women for estrogen level to go up?
Well, actually, and this has been proven with many studies, that the best diet for fertility is the Mediterranean diet. Okay, and I'm not saying this because I'm Italian.
I'm Italian too.
Exactly.
I now say that.
But this has been proven scientifically. So yeah, the Mediterranean diet is supposed to be the best.
Olive oil, vegetable, fruits,
fish. Yeah, absolutely.
Carbs.
Yeah, a certain amount of carbs can be. Again, balance is key. Okay, you shouldn't cut completely a certain type of food as long as everything is balanced. Even fat, to some extent, can be important.
Of course, olive oil, not only to taste so that the food tastes better, but also for a healthy body and healthy mind.
Absolutely.
I want to touch a subject which is very close to women. Which is miscarriage. Now, miscarriage is very frequent. I actually have one person in my family who had miscarriage 4 times. The last time she had miscarriage on the 8th month, and she was in bed because she had a complicated pregnancy. And then she decided not to have babies anymore, because she's like, I'm not only destroyed, not only my body is destroyed, but also I'm destroyed emotionally. Is there anything that we can prevent miscarriage?
Yeah, now thank you for touching base on this, because miscarriage is a devastating experience, both physically but also psychologically, for actually both men and women, because even men suffer, they might suffer differently, they might not voice their suffer, but they suffer. Okay, so we need to do everything we can to try to prevent miscarriages, and there is a lot we can do. First of all, it's very important to try to identify the reason for the miscarriage. So we should do some investigations to see whether there could be a genetic reason, which sometimes is the case, a hormonal reason, okay, so check the hormones again, or an anatomical reason, whether the uterus, for example, can have some anatomical problems. That's when it's important to do a scan, possibly a 3D scan, which will put in evidence the uterine cavity where the pregnancy implants. And in some cases, which is an area where I'm specialized, the reason can be immune. So the immune system can trigger a negative response against the body. So because we need to understand that in order to tolerate, the baby is different from the mother genetically. So pregnancy is the only example where we accept in our body something that is not genetically like us. And that requires a big toleration from our immune system. And sometimes that toleration is not working well, and that's when the immune system can unfortunately attack the baby. And in this case, there are some tests that can identify the problem, and there is a very good treatment for that. Which is a combination of medication. It's not just one medication. And it depends on the reason. There are several immune mechanisms by which this can happen, and once we have identified the mechanism through the test, we can find the best treatment for this condition. But yeah, there is a treatment and it's very, very effective.
Fantastic. And do you think there is such a good time to get pregnant?
Well, again, I would say the sooner the better, because one of the biggest mistake that can be done is to wait for too long.
Okay, but you know, now there is a lot of these app that, oh, now it's the right time, let's go, let's have sex because this is the right time to conceive, and this brings so much stress on people. So also stress will not help fertility, in my opinion. What do you think about those apps?
Well, you know, again, they need to be used wisely, because women should be aware, and also men should be aware about the fertility window, which in a woman starts 3-4 days before ovulation, and the day of ovulation is also important, and maybe the day after, but more the 3-4 days preceding ovulation and the day of the ovulation. That is called the fertile window. So during that time, that's when you know, the sexual activity should be as much as possible for conception.
And when is the right time? For example, you try to have a baby, try naturally, not happening. When is the right time to start IVF?
Well, the diagnosis of fertility by the World Health Organization, WHO, entails at least 12 months in women below 35. Mm-hmm. Okay, so you should try for at least 12 months consecutively. Okay,
12 months to a year, yeah?
Yeah, below 35 of age. And above 35, this period is reduced to 6 months. So if a woman is above 35, then 6 months of no conception can be enough to do some further investigation. That doesn't mean necessarily IVF, but I would say to do more investigations.
And do you have like a tip that you can give people who want to start IVF? Or is there anything that you are saying, oh, I wish people understood this before starting?
Well, first of all, to have an assessment of their fertility for both men and women. Even before thinking to conceive, even if a couple is not ready, to have a general assessment can be very helpful to know where they stand and to make informed decision. Because, for example, if we see that a woman has a reduced ovarian reserve, so a lower amount of eggs for her age, and I see many young women with already a reduced amount of eggs, they could think about either conceiving sooner if they are ready, or freezing their eggs, for example. And the same for men. I would do ideally a semen analysis to every man at a young age as a screening, so they know whether they might have problems when eventually they are ready to have a baby, or whether everything is fine. So again, prevention is very important. And before preparing to IVF, it would be good to be ready also from a body point of view. So again, things like having a good diet,
exercising,
having a normal weight are very important, because not everybody knows that an egg and also the sperm have a cycle of life of 3 months.
Oh.
So whatever you do in the 3 months before has an impact on the quality of the egg and the sperm. It's not, doesn't happen overnight. It's not that you start eating well today and tomorrow your eggs will be wonderful. So it takes at least 3 months. That's why, particularly before IVF, I ask all my patients to start paying attention to diet, taking the right supplements, doing physical activity in order to prepare, because preparation is key to have better success.
Of course, fail to prepare, prepare to fail.
And that's absolutely, that couldn't be any more true for IVF.
You say supplements. What kind of supplements?
Well, this is a specific field with a professional. In my clinic, I've got 3 nutritionists, for example, that work with me, because it's a separate field that requires the right expertise. So we can't improvise. Even us as fertility specialists can't improvise and give just general advice, because every person is different. We eat differently, so the advice would need to be tailored to the specific person. That's why there's nothing better than having a proper fertility specialist to give advice on that. But generally speaking, things like coenzyme Q10, for example, is proven to have a very important effect on fertility. All the vitamins are important, particularly vitamin D. Mm-hmm. There is a proven correlation between vitamin D and fertility, both in men and women. Plus, for women, folic acid is very important to prevent some problems.
There is also this other false myth. When a man bring the mobile phone near their testicles, do you think this decrease sperm counts?
Well, again, certainly if a man could avoid doing that, being close to source of heat, and that is the same for sauna, for example, jacuzzi, having your laptop on your waist for a long time, that would be preferable. But that depends also on the individual. There are individuals in which this might not have a big impact, whereas some others could have a bigger impact. But the advice would be try to avoid this if you can.
About egg freezing, it's a bit of a difficult procedure as well, because women are going to be emotionally overwhelmed. They are going to have to take some hormones, right?
Yeah.
What's the process?
Yeah. Well, actually, yes. The process entails the process entails about 10 days of daily administration of a hormone called FSH, which, by the way, is nothing strange to the body. It's something that we already produce to produce egg and sperm. So we just give a bit more than we naturally produce to stimulate more the development of more eggs. So that's another myth to debunk. It's not dangerous, and women will not get crazy. Okay? Yes, some of them might be a bit more emotional, maybe during these 10 days, but normally it's very manageable. So I would encourage our patients not to be scared about this.
But is it true that you can put a little bit on weight? Because many women are also afraid to put on weight or to have water retention. Can this increase water retention?
Yeah, of course, yes. Water retention is hormonally driven, so that is true. Very often patients can put on from 1 to 2 kilograms during the treatment, but this is mainly water retention. That means that once they stop the medication, they should lose all of this. Okay? So there is no permanent weight gain unless clearly a woman starts eating more as a result of the stress, but that is different. If you don't eat more, normally it's just fluid retention and you lose it soon after stopping the treatment.
And what about IVF? Can you just educate us on the process, please?
Well, the process is very similar both for egg freezing and IVF, because the first part is the same. You need to stimulate the production of eggs with 10 days of hormones. The difference is that for egg freezing, you just extract the eggs and you freeze them. For IVF, you put the eggs together with the sperm to create the embryos, and then you can decide whether to implant an embryo after a few days in the uterus, or, for example, which is something I recommend particularly in women above the age of 38, to test the embryos genetically, so you know in advance which embryos are genetically viable, and you discard all the embryos which have a genetic problem, and this way you can also reduce the risk of miscarriage, because you select only the embryos that are genetically good, and you only implant the embryos that are genetically perfect.
Give me 3 major things that people can do to help fertility in male and female.
Okay, well, the things that is valid for both, we have already discussed this, is to prepare in the best possible way, from a nutrition perspective, from a lifestyle perspective, at least 3 months in advance. Okay. Then for women particularly is not to wait unnecessarily. Okay. So to start trying for a baby, yes, when you're ready, and if you're not ready, to think about preserving your fertility.
With egg freezing.
Exactly. Or even embryo freezing. If you are already in a stable relationship, you can think about freezing embryos, which is even better.
Dr. Simone, is more important the age of the egg or the age of the uterus?
Well, definitely the age of the egg. And we have a lot of evidence of this. For example, women undergoing egg donation have the same success rate as if they were much younger. Okay, so once they use an egg of a younger age, that gives them a very, very high chance to carry the pregnancy. So I would say it's definitely more important the age of the egg. Having said that, we need to make sure that still older women are healthy and they don't have, for example, uterine problems or anatomical problems like fibroids, polyps. But if a uterus is healthy, it can work very well even past the age of 50.
Dr. Simone, what is the success rate of IVF or egg freezing?
That mainly depends on the maternal age. Okay, the older a woman is, the lower is the success rate of IVF, because the egg quality, which is age related, is still the main factor to determine success. So just to give you a general answer, below the age of 35, at least 50% of the eggs are genetically perfect. So below the age of 35, you would expect approximately between 40 and 50% of success for each embryo you implant. So every time you transfer an embryo in the uterus, in a woman below the age of 35, you would expect 40 to 50% of success. From 35 years old onwards, that 50% starts decreasing gradually. up to the age of 42, 43, when we start having a success between 5 and 10%. Okay.
I feel like fertility is pretty much about age. For me, I never believe in age, but I think this is one of the problem with age is only linked to fertility.
That's very true. That's very true. Age remains the main factor. It overrides everything else. Yeah, we are talking about stress, for example, nutrition. These are all important things, but age is far more important than all of that.
And Dr. Simone, are we turning something that is so natural, like making love and have babies, in something that is stressful and with over-tracking, over-trying, over everything?
Okay, so once we see that everything is fine through an assessment, then you can tell the couple that they can relax and they can try naturally and see what happens. But if we actually evidence a problem in the first investigations, that's when I think a medical intervention would help our patients.
Is there anything that you can consider is taboo when we speak about fertility?
Well, some people is still reluctant to talk about fertility, particularly men sometimes. You know, there's no reason to be ashamed, and I would encourage particularly men, but also all the people who might experience problems with fertility to really ask for help, because it shouldn't be the case where people is fearful to talk about that.
I think it's also the problem is that many men think that fertility is linked to virility and being a man for men, but it's not about that.
No, it's absolutely not about that. I agree with you. So yeah, it doesn't affect the virility of a man, absolutely, and they should be addressed separately. Although sometimes that can be a connection. For example, if a man has a hormonal imbalance or things like low testosterone, that can in turn affect the production of sperm. So sometimes there is a connection, and that's when asking help can really be helpful.
Can too much testosterone also be bad for fertility?
Absolutely, absolutely.
So too much of a man also not good.
Too much testosterone, particularly for men who are taking this for other reasons, like to build up muscles, for example. This is proven to reduce the number of sperm, so it can be very bad for fertility.
So too little testosterone or too much testosterone
exactly
is not good.
Is not good.
So balance, as we say,
Balance.
The truth is in the middle.
Absolutely.
About endometriosis.
Well, endometriosis is a condition that can affect fertility in the measure that can sometimes disrupt the anatomical relationship between the pelvic organs. So, for example, it's a very severe endometriosis. It can cause adhesions, which can dislocate the fallopian tubes, and they lose the connection between fallopian tube and ovary. So it can well be an anatomical reason for infertility. The effect on the implantation is actually not fully demonstrated, and that's why women with endometriosis can still be fertile. So it's not an automatical diagnosis of infertility.
So it comes before the chicken or the egg?
Well, again, I would stick to the criteria we have discussed. Below the age of 35, I would encourage, if there are no other problems, to try even with endometriosis, okay, because a lot of women can conceive. If ovulation is not affected, as is rarely the case, conception can happen. Above the age of 35, 6 months are enough, and if conception doesn't take place, then we can look into what to do to help.
Can a woman in her 50 become pregnant naturally?
Well, naturally with her own eggs is actually almost impossible. Almost impossible. Almost. I mean, there might be very anecdotal cases, but I wouldn't rely on that, because even past the age of 44, 45, it's very, very difficult. So at 50, it's almost impossible with your own eggs. If you use donor eggs, then it can be successful.
It's difficult but not impossible, so you may be the exception. Keep trying, have sex, eat healthy, move, exercise. My God, thank you, Dr. Simone. This was so educational. I learned so much, and we will love to have you in the show one more time to talk maybe about menopause, women hormones. It was so interesting. Thank you so much.
Thank you, Francesca, for having me. Thank you very much.
Bye.